Robitussin, an over-the-counter cough syrup, contains dextromethorphan to suppress cough and comes in different formulations for specific symptoms. Although effective, it can cause side effects such as drowsiness and may not be suitable for all cough types. Always adhere to dosage instruction and seek medical advice if necessary. Next is the pharmacological properties. Robitussin features dextromethorphan, which calm the brain cough trigger, reducing the urge to cough. Additionally, it may contain guaifenesin, aiding mucus thinning for easier expulsion, and together these components offer reliefs from coughing and related symptoms. For the indication, Robitussin is meant to ease cough caused by minor throat and bronchial irritation, commonly triggered by common cold or inhaled irritants. It effectively suppresses dry, hacking coughs and provides comfort to irritate throat tissue. For the contraindication, avoid Robitussin if allergy to its ingredients, have chronic cough condition like asthma, or are taking monoamine oxidase inhibitor. Use caution in respiratory depression, children under certain age, and during pregnancy or breastfeeding. For the side effect, drowsiness, dizziness, nausea, and constipation. The interaction, Robitussin could interact with monoamine oxidase inhibitor and other drugs causing drowsiness or the central nervous system depression, potentially resulting in severe effects. It's essential to consult a healthcare professional before combining Robitussin with other medication. For the dosage and administration, for adults and children over 12 years old, the typical dosage of Robitussin is 10 to 20 ml every 4 hours as needed. However, it's essential to follow the instruction on the label or as directed by a healthcare professional. For children under 12 years old, dosage may vary based on age and weight, so always consult with healthcare provider for proper guidance. For the nursing intervention, first is assessing the patient medical history and current medication to ensure safe administration. Second is educating patient on proper dosage, administration, and potential side effects. Third is monitoring for adverse reaction, especially in patients with respiratory condition or who are taking other medication. Fourth is to encouraging adequate hydration to help loosen mucus and facilitate coughing. Fifth is advising patient to avoid driving or operating heavy machinery if experience drowsiness or dizziness. Lastly, documenting administration and patient response to treatment for continuity of care. Always remember that nurses should also be aware of any specific patient allergy or contradiction to Robitussin and consult it with healthcare professional as needed for individualized care. Next is the analyze and research. Analyzing research about Robitussin involves reviewing studies and literature to understand its effectiveness, safety profile, potential side effect, and any emerging findings. Researchers might investigate various aspects, such as pharmacological mechanism of its active ingredients, clinical trials assessing its efficacy in managing cough symptoms, pharmacokinetic properties, and adverse reaction. This analysis helps healthcare professionals and consumers make informed decisions about its use, identify any gaps in knowledge, and explore new avenues for research and development in cough treatment. For the evidence-based practice guidelines for Robitussin include dosage, recommendation, indication for use, safety consideration, monitoring parameters, and patient education. For the critical thinking, or the last part of the PowerPoint, it involves assessing its effectiveness, safety, and suitability based on evidence, patient factor, risk versus benefits, alternative, guidelines, and monitoring outcomes.